Guys, today we will learn about what is syphilis test and its procedure. First, we will talk about what is syphilis. Syphilis is a common sexually transmitted infection that can cause serious illness. Having an active syphilis infection increases the risk you will get HIV or you will give HIV to someone else. HIV is incurable and can be fatal. If you are a pregnant woman, syphilis increases the risk that the pregnancy will end in miscarriage, death of the baby at birth, or in infancy, or permanent disabilities for your baby. Fortunately, syphilis can be diagnosed with a blood test and antibiotics such as penicillin. Now we will talk about syphilis test and its procedure. Tear upon the pouch along the V notch and remove the test cassette from the pouch and place the test cassette on a clean and plain surface like this and remove the dropper from the pouch and place this dropper on a clean and plain surface. We can remove the silica gel from the pouch. We will collect 2 drops of human serum and put this human serum into the sample well as using the sample dropper. We will put only 2 drops of serum in the sample well. This human serum is running towards the control and test region. If bands occurs at test and control region, it means sample is positive for treponema palladium antibodies. If band occurs at control region only, it means sample is negative for treponema palladium antibodies. You can see, guys.